Did you know that I can look at your fingernails and see just how much stomach acid you have and how healthy your digestion is? So if you look at your nails, I'm looking for serrations. I'm looking for strong lunuli in your thumb, your index finger, and your middle finger. So those are those little half moon shapes. So we want them nice and strong. So they're going to be strongest on your thumb, and then they get weaker, and then your pinky, you probably shouldn't see any. There should be something on these 3 digits. And if it's not, it means that there's some kind of absorbency issue. And what that means to me is you have low stomach acid. If you are someone who is burping all the time, or has indigestion, or stomach pain, or bloating, please listen to this because this is going to be brand new information for you. If you are someone who's experiencing those symptoms and you've gone through bottles of Tums and you've gone to the doctor and you're just like, I can't take it anymore, somebody help me, what do they do? If you're really experiencing symptoms, they might give you like a pink lady, proton pump inhibitors. They might just put you on antacids, or they'll give you a handout and be like, here, you probably have GERD, figure it out. Usually these symptoms are not caused by too much stomach acid, even though it feels that way, right? Sometimes it feels like our food is in our throat, or it feels like we're about to throw up, or the heartburn is just too much. But usually it's caused from low stomach acid, not too much. So if you're then treated to lower your stomach acid even more when you already have low stomach acid, do you think that your symptoms are going to resolve, or are they going to get worse? They're probably going to get worse. So by further reducing the amount of stomach acid you have, it's going to slow digestion, increase small intestine bacteria overgrowth, SIBO. It's going to weaken your immunity, and the worst one, it's going to increase fermentation. In functional nutrition, fermentation is a huge thing. So if you're always gassy, if you're always bloated, it means that you have some kind of fermentation issue. And how do we even get low stomach acid? Usually it's from chronic stress. A lot of it too is from chronically under eating. So if you are someone who's just forgotten to eat, or if you have a busy job and you just created poor habits of not eating enough or not eating often enough, that could happen as well. Low zinc, blood sugar instability, and poor vagus nerve tone. And I'm going to make a whole post about the vagus nerve and its role in all kinds of things some other time, but that plays a huge factor as well. You've just done a bout of antibiotics. There's lots of things that we need to do if you have taken antibiotics. So the easiest way for you to get back on track is just training your body to start eating every couple hours again. And it's really hard when we have this BS culture of intermittent fasting, and make sure you're fasting. Stop the intermittent fasting. Eat every 3 to 4 hours, no skipping ever. Make sure you're not drinking coffee on an empty stomach. You're eating breakfast first thing in the morning. Again, no intermittent fasting ever. And always include 20 to 30 grams of protein at every meal. I know it sounds like a broken record, but this isn't make sure you're eating your protein for sports nutrition and performance and making sure you look good. You need protein. If you have any type of digestive issue, you need to prioritize protein and fiber, but protein. Sometimes I will recommend this apple cider vinegar diluted with warm water, and you can drink that first thing in the morning. I know it tastes gross, and no, the capsules are not the same. If you want to use apple cider vinegar, you have to use the drink with the mother, like the SCOBY still in it. A teaspoon of that mixed with warm water. You drink that back first thing in the morning on an empty stomach. That sometimes helps a lot of people. Digestive bitters are also good as well, supplementing with zinc and B vitamins. If you want something more strategic and more tailored to you, please come see me. We can meet virtually. We'll get a tailored plan for you for more advanced support than just, hey, take some B vitamins. You probably have some kind of fermentation going on in your belly, low stomach acid, and it's just affecting everything. And what does it affect? Well, let me tell you. People always downplay the digestive system, but the stomach and stomach acid is not just about digestion. It's the whole entry point to the entire metabolic, hormonal, immunal, neurological system. It is the entry point, and we're treating it like garbage. You're absorbing nutrients, but really, really weak. Obviously, you're functioning, so you're absorbing something. Not enough, especially if you have some kind of imbalance. So you need more stomach acid, increase your absorbency issue. Hormones need nutrients to function. If you have low stomach acid and you're always experiencing heartburn and upper digestive issues like that, you probably have some kind of hormone imbalance. PMS or estrogen dominance issues or Could be anything. It could be anything with your hormones. Your hormones need nutrients to function. It also affects your skin. So do you have psoriasis or eczema all the time? You might have low stomach acid. You have an immunity issue in general. Just think, when stomach acid is low, metabolism slows. So if you even have a hint, just like a hint of heartburn, please try these things. If you don't get anywhere and you need more advanced support, send me a message. We'll meet and I'll get a tailored plan going for you.